Hello, everyone. This is Susan Dentel from the Faculty Professional Development Committee, and today we are hosting our very first faculty webinar. And today we have Mary Burns-Coral, who will be joining us, and she is going to talk about some of her courses and some of her teaching ideas. Mary, can you give us a virtual tour of one of your courses?
Sure. Thanks very much, Susan. I want to preempt this, though, by thanking the Faculty Professional Development for risking having me be the first webinar presenter. And I also wanted to thank a couple of my nursing colleagues, Teresa Dubiel, for her willing to allow me to use her Find It quiz for my pharmacology. That has been very helpful in enabling my DL pharmacology course to be more successful. And I kind of tweaked it so it works great. And also for Gloria Velarde, who has allowed me to put the pharmacology course, since she's the course coordinator of that course, for putting that online. It has been very helpful for many of our nursing students who have want to take it early or who are currently taking fundamentals and find that an online course works best for their schedule. I also wanted to thank the COD for the professionalism of their courses and how they design them. Specifically, Joanna Elliott, Gloria Eccleston. I know Rico is no longer here, but he's the one who helped set up the course. So I'm going to show my screen now, and we're going to go to my pharmacology course first. Oh, I also want to thank Connie Foster, who got me started on the idea of rubrics, and I kind of went with it. So I'm going to show you two ways that I use rubrics. First with my pharmacology course, and then I have myself as a student in my master course, so you'll see how I do the rubrics for grading the discussion board. Hang on a second while I show my screen, and then I'm going to take you to my Blackboard course site. Thanks for your patience. Okay, you'll see my Blackboard course site. And I'm going to go to my master course right here. And every week I have two case studies that the students, and they're broken up into group A for awesome, group B for bodacious, and group C for cool. So usually I have probably around 30 students, so this gets about 10 students into each group. But I do have discussion questions, and there's two each week. And so I can find the discussion questions and update them and keep them current. And so then how I do the rubrics is, let's say I'm going down to my grade center, first of all, and there is myself as a student. So I'm going to DQ1 and I edit my column information. And so I'm adding my rubric, select rubric. Now, just so you know, it will show the rubric that I'm currently using, but I have revised them a couple times just because they didn't really look exactly what I wanted. So this is as an instructor, I'm adding my rubric now. So I'm submitting it for that week 1. And do you see down here where it says where I want the students to be able to see the rubric with the rubric scores right there. So then I have to click submit. Now this took me a little bit to learn, and I'll tell you another example. So for week 1, I'm going to grade this student myself. So I'm going to view grade details. I'm going to view the rubric. And it pulls the rubric right up here. So you can do grid view or list view. So right up here is my description. So in other words, the discussion questions, they get 1.5 points for each discussion question, which there's 2 per week. So if they did 2 entries for the week, then I would just click on that and put 3 in. If they did evidence-based support, they supported their comment, then I would put 1 point in. If they also had 2 substantial responses to 2 colleagues per discussion question, I would put 0.75 in there. And then if they had correct spelling and grammar, I would put 0.25. And you see where the emphasis is on this rubric. It's of course on the fact that they responded twice to each of the discussion questions and for the evidence-based support. The reason why I didn't put points when I built my rubric is because some of the students don't necessarily put evidence-based support, so then I'll put 0, or they might have only done 1 on one of their discussion questions, so it allows me to tweak those points. So then here I can add up the points, so I'll add up the points for a Mary Burns Choral student, and then I can give them feedback. Thanks for your substantive responses to the DQs for week whatever. I can put that in there, and then, so I'm going to go ahead and do that to the week 1 DQs. And I always put best wishes. That's how I put things and my name. And then I save it here. But then I have to have one other step, and this is where myself and my clinical faculty who use rubrics also that I've developed have a little bit of difficulty, but they have to save twice. So I'm going to save that. And so that is saved now in my grading rubric. So the student can see that under my grades. If I want to add any other comments, or I'll give an example when I pull up my students' clinical anecdotals, then I can add comments right in here, override the grade, or whatever I need to do, and save it. But the student will be able to see that grade, and I'm going to not overwrite, I'm just going to say save. So that's helped make grading my discussion board very easy for my 3 different groups. I do that weekly, and that's been very helpful because the students know exactly what they're being graded on. Now I'm going to go back to I don't have a master course for my fall, for my med surg course, but I'm going to kind of give you a little tour of how I use rubrics for that. And I use them a couple different ways. You'll see I use some comical things, mnemonics, pictures, visuals to help students understand, and I do that for each one of my courses. I'm going to go ahead here and show you that. Do you see this button that's blacked off? This has student skill demos. And this is where we're doing IV videotaping of them starting an IV on an arm in SimLab. And now my clinical faculty are able to go on here and actually look at the videos of different students and watch that video, and just click on that and watch that video. Once they're able to watch that video, then they go right to a rubric. So usually what I do is just open up another Blackboard window to see that. But I'm going to go here and go to my grade center so you can see the rubric. And I also put myself here as a student. So here's my IV insertion videotape. So as the faculty, I have to first of all link it to my rubric that I have. And so I already have a rubric here, and it says yes with scores. So I already have that added for the IV insertion. I don't give any points because it's pass fail, so there are no points attached to that. So now I'm going to show Mary Burns Choral, the student, after I've watched her IV insertion video. So I'm going to view the rubric, and you'll see I tweaked this a couple times too so that it is exactly the rubric that the students have in a piece of paper. So they know this ahead of time. I've asterisked the Q ones that they have to address. I put that also up in here so that they'll know exactly what steps, if they miss, that is why they're going to have to re-videotape. So I put it novice, competent, and proficient. So did they ID the patient? And I'm just going to click, I put 0 points because it's pass fail, so there's no points, but they do. This is not one of the key indicators that they have to pass. So if I click, say, yes, they did ID the patient, they explained the procedure and disinfected the table. Oh, they missed this step. They self-corrected it, however, later on in the video. Then they're able to, then I could click that because I tell them if they're able to remember that step and go back and say, oh yeah, I forgot to disinfect the table. I forgot to explain the procedure to the patient. So I would have done that. If they can do that, then they will go ahead and get this, they recorrected, but that doesn't mean that they failed, even though it's a key indicator. So did they set up their supplies aseptically? Yay, they passed this. Did they apply the tourniquet and assess the veins? Yay, they passed it. Did they choose the vein that they were going to use? So you see that's not an indicator, so it really doesn't matter. So I'll go ahead and click that. Did they remove the tourniquet? Yay, they passed that. Did they reapply the tourniquet? Yay, they passed that. They put on sterile gloves. They inserted the catheter, stabilizing the vein using a two-handed technique or floating cannula. Did they remove the tourniquet? And I tell them, because it's a mannequin, a lot of times the mannequin's not going to cry out in pain, so they have to remember that step. Sometimes they get really caught up in the step and they forget that. So if they miss that step and self-correct it in the video, then they'll be able to pass. So I'm just going to go through this, and yay, yay, Mary Burns Coral passed all of this. Isn't that wonderful? So there's no points, and so I will say to the student, greetings, student, you have successfully completed the IV insertion skills video. And then I will save that. And then again, it's in the grade details. I have to save again. So another thing that I will do a lot of times, I will go back to the grade center and I will send the student right after I'm done grading, I will send them an email. So I'll email the user and send them an email saying their grading has been completed, and they can look under the My Grades tab for their grade on that video. Another thing that I now have used, and I've tweaked it like 3 different times, is the anecdotals, the clinical anecdotals. And I've had to create 6 weeks because we do 6 weeks of clinicals. So I've had to create an anecdotal column for each week. So now I'm going to show you my clinical anecdotals. And you see I have a couple rubrics, but this is the only one. I want the weekly one that's going to show, because it doesn't allow me, if I name it the same thing, it will not allow me to delete it. So now I have the weekly anecdotal here for week 1 for Mary Burns Coral, the student nurse at the VA hospital, because that's where I work. So I'm going to show you exactly, and my clinical faculty really like it. And what it's good for too is that I can see how they're documenting incidences with my students too. Even though I'm not in that clinical, I can see that and I can help them. So if they're having a problem, with documentation. I can see and guide them in their documentation because it's essential that we be very objective in how we document our students in the clinical situation because it can be subjective many times. So now I'm going to view that rubric for Mary Burns Coral student for the anecdotal. And I have it set up exactly like my printed copy. We have 8 clinical objectives for our entire nursing program, and we all have to follow the same guidelines for those 8 clinical objectives. So 2 means satisfactory, 1 means level 1 means work, and 0 means unsatisfactory needs remediation. So I have it set up under professional behaviors and little cues under every single one. So I would mark those, and then when I mark them, if there's anything that is level 1 or 0, I ask my clinical faculty and myself to give them feedback, and it has to be very objective. What did they observe the student doing in the clinical facility exactly? Did they need to give them maximal cueing, or did they need to give them 3 or 4 prompts before they were able to pass a medication successfully? So I have found this tool to be very, very helpful. Not only that, but in Blackboard, then it's a permanent record. Now, I know some of my colleagues in nursing are probably going to say, well, then how is the student able to comment? Well, I tell the student, I email them the same way I did about the IV insertion. I email them and say, your anecdotals are ready. If they have any comments, then I'm going to go ahead and add that student comment right in that document under the grade. So I can go to manually override, and I will put the student's comments right in here that they have. If they disagree with something, I don't have any problem putting on that. But what that does then is that saves the entire document in Blackboard. So that never goes away, and that becomes a permanent record. So that's how I use currently for my course is the grading rubric. And I also have a reflective journaling in my Nursing 223 course. And in that reflective journaling, the students critically use their critical thinking, clinical judgment, sharing about their clinical experience that week. So it's a weekly one. And I do have a rubric developed for that too for the faculty so they know what they have to do in order to get a 2 on their weekly anecdotal. I'm not going to show that right now. I'm going to go back, and I just want to show you briefly how my pharmacology online course is set up. I'm pretty pleased with how the faculty, how the College on Demand has set it up so professionally. But under my Documents tab, I now have Sandy McCarthy, who has set up for both my nursing course and my pharmacology course access to micromedics, to facts and comparisons, e-answers, to CINAHL, to AHRQ, and National Clearinghouse guidelines. So if they're on campus, they can click right on those links. It'll take them right to those databases. If they're off campus, it says already that they have to log in using their WCC net ID and password. But for both of my courses, they have to use in their reflective journaling and in their discussion groups, they have to use evidence-based rationale. So it can't be just their words, but it has to be um, citations from other sources. I also have a netiquette guidelines, so professionalism, how to communicate professionally. I also have math guidelines because I have very specific ways. I give at least 2 math quizzes or 2 math questions on every weekly exam. Along with the course syllabus. And then the units are set up by weeks. And I'm going to go ahead and pull up week 4, which is drugs affecting the cardiovascular system, because I figured most of you would probably be able to recognize that these are antihypertensives. So again, I used mnemonics and comic humor to kind of show ways that students can visualize and remember some of these drugs. But here is how it starts off, just a brief introduction to the unit, kind of summarizing things, giving the students textbook reading, the lectures, and I'll go over the lectures in just a minute, a discussion where the discussion board is. There is a content review activity, which is a matching activity. And then here is the memory sheet, which they can download in a Word format to the drugs for units 4, 5, and 6, which are all cardiovascular. And then a cue down here about the exam that after they've completed the NCLEX practice quiz with a 90% or higher, they're ready to take the exam. So here's what's really unique about the pharmacology course is now they have timed so they can tell, the student can see how long is that video that I'm going to be watching of the lecture. And so we're going to go to the first one, Introduction to Cardiovascular Unit and Anti-Lipemic Agents. And this is delivered in the clouds. So it gives the students opportunities of several different methods. They can watch the video, entire one. They know exactly how long it's going to be. They can download the PowerPoint, and on the PowerPoint, what I have there is notes in the notes section, and I also review all the anatomy, physiology, and pathophysiology that they need to understand. If they want to download just the lecture, the audio part, they can download it on MP3 file. If they don't want to listen to the entire lecture, they can go ahead and just click on the prototypes that I'm discussing in the lecture, which are right there is all they have to click. So they go to fibrates and they click right onto fibrates, and it brings up the section where I lecture on fibrates. One that we're going to talk about is our fibrates prototype. Jim Fibrosol. So that's just a really kind of a neat way that the lecture material is presented to students. So if they don't feel they want to listen to the entire lecture, they do not have to. Also, the content review activity brings them, they click to start, and so it tells them it's very simple to use. They click on the term, and then they have to find what does the definition of high density lipoprotein, HDL, okay? And so they would look in here and they would go and put that right under there. Okay, we know it. Oh, it says your current selection. Okay, so I'm going to start it over again. There, now it moved it for me. And so it says correct. It won't move it if it's incorrect. Okay, and I know that there is at least 3 or 4 pages of this. So this helps them also as another way to memorize. Okay. So that about sums it up for my pharmacology course and for my nursing 223. And again, I'm very thankful for the professionalism of at Washtenaw Community College, because I've taught in a couple other community colleges, and I've pretty much cobbled my online courses or hybrid courses because I had to create my own PowerPoints, and then I had to audio record, and then I had to compress it because it was too many bytes material in order to post it on another server. And it was not professional at all. I'd have to be honest. It was just kind of cobbled up. But this definitely is professional, and that's the quality of the institution that speaks for itself. So thank you very much for taking the time out to listen to me. And if there's anyone that needs guidance, help on creating rubrics, again, like I said, I trialed it. you have to, from course to course, I have to import the rubrics and export the rubrics. So once I've created them, I have to import and export from course to course, but they certainly are a tool which helps my job make it much, much easier and also gives quick feedback for the students. Thank you very much.
Thank you, Mary. This was both interesting and informative, and Faculty Professional Development Committee would like to thank you.
Thank you.